Do you have sciatica, leg pain in the morning, and difficulty getting out of bed? In this video, I will show you a simple 3-step routine that can help reduce leg pain from an L4-5 disc bulge before you even get out of bed in the morning. I'll also walk you through each step, explain why it works, and also show you the biggest mistake to avoid so you don't make your leg pain worse. Hi, I'm Dr. Tam, a chiropractor here in San Jose, California. Before I show you exactly what to do in the morning, it helps to understand why sciatica often feels worse when you first get out of bed if you have an L4-5 or an L5-S1 disc bulge. While you're laying down or sleeping, your spine isn't carrying your body weight. During that time, the discs between your vertebrae gradually absorb fluid through a normal process called imbibition. Think of your spinal discs like a sponge. After being loaded for several hours, they naturally soak up more fluid and become slightly fuller by the morning. For most people, that's completely normal and doesn't cause any problems. But if you already have an irritated or bulging disc bulge that's contributing to sciatica, that extra fluid can temporarily increase the pressure inside the disc and make it more sensitive. Now here's what happens next. From the moment you swing your legs out of bed, stand up, and put your full body weight through your lower back, that disc is suddenly loaded. If it's already irritated, that increase in load can aggravate an already inflamed tissue around the disc and the nearby spinal nerve, triggering that familiar shooting pain, burning sensation, or numbness that travels down your leg. If you've ever thought, I was feeling okay lying in bed, but the second I stood up, my leg pain came back. That's the reason why. And that's also why one of the biggest mistakes people make is going from lying in bed to standing up as quickly as possible. Instead, you want to give your lower back a chance to gradually prepare for that load. That's exactly what this 3-step morning routine is designed to do. It helps to calm the irritated nerve, gently prepare your lower back before you stand, and reduce the chances of triggering a painful sciatica flare-up with those very first steps of the day. I recommend making this part of your morning routine every day, especially while you're recovering from an L4-5 or an L5-S1 disc bulge, and consistency gives your irritated tissues the best chance to calm down over time. The first step is the supine sciatic nerve glide. The goal of this exercise isn't to stretch your hamstring or stretch out that sciatic nerve. In fact, pulling too hard on an already irritated nerve can actually make your symptoms worse. Instead, think of it like a gentle mobility exercise for the nerve itself. Now, your sciatic nerve is designed to slide and glide as you move your hip, knee, and ankle throughout the day. But when a disc bulge at an L4-5 or an L5-S1 irritates the nerve roots, that normal movement can become more sensitive. After lying in bed all night, it's common for the nerve to feel stiff and less tolerant to movement. A gentle nerve glide can actually help restore that normal sliding motion before you ask it to handle the stress of standing and walking. Stay lying comfortably on your back with both your knees bent and your feet resting on the bed. This position helps to keep your lower back relaxed. Now, slowly straighten the leg that's affected by the sciatica as far as you feel comfortable. It doesn't need to be completely straight. A slight bend in the knee is perfectly fine if that's where your symptoms allow. Once you're there, slowly pull your toes up towards your shin. Then, gently point your toes away from you. That's 1 repetition. Continue moving your ankle back and forth while keeping the movement slow and controlled for about 10 repetitions. Let your breathing stay relaxed and avoid bouncing or forcing the motion. As you perform the exercise, you may notice a mild pulling sensation behind your thigh or calf, or a gentle awareness of the nerve moving. That's generally what we are looking for. Many people also notice that the leg begins to feel a little looser or less sensitive after several repetitions. It may not eliminate your pain completely, but even a small reduction in stiffness or nerve sensitivity can make the next step more comfortable. What you should not feel is a sharp electric or shooting pain down your leg. If that happens, don't push through it. Simply straighten your knee a little less, make the ankle movement smaller, or stop the exercise altogether. With nerve glides, gentle is almost always better than aggressive. Once you've completed your 10 repetitions, your sciatic nerve has had a chance to gradually wake up before you place weight through the spine. Now, the next step is just as important. How you get out of bed can either protect your lower back or put unnecessary stress on an already irritated disc. The second step is the log roll technique. This isn't just an easier way to get out of bed, it's one of the best ways to protect an irritated L4-5 L5-S1 disc. One of the biggest mistakes people make is sitting straight up like they're doing a sit-up or twisting their body as they swing their legs over the side of the bed. Those movements place unnecessary stress on the lower back, especially first thing in the morning when your disc is more hydrated and more sensitive to loading. The log roll technique keeps your shoulders and hips and pelvis moving together as one unit. By avoiding twisting through your lumbar spine, you reduce unnecessary stress on the injured disc while getting into a safe sitting position. Start by bending both of your knees while you're still lying on your back. This helps relax your lower back and makes the movement easier. Next, gently tighten your abdominal muscle as though you're bracing for someone to lightly poke you in the stomach. You don't need to suck your stomach in. Just create a little stability through your core. Now, roll your entire body towards the edge of the bed in one smooth motion. Your shoulders, trunk, hips, and knees should all move together, almost like a log rolling through the ground. Once you're lying on your side, let both legs slowly drop over the edge of the bed while, at the same time, using your arms and your elbow to push your upper body into a sitting position. Try to make these movements happen together. As your legs lower, your arms help lift your body up. This allows your arms and legs to do most of the work instead of your lower back. Once you're sitting on the edge of the bed, keep both feet flat on the floor. Simply pause for a few seconds. This gives your body a chance to adjust before standing and allows any lightheadedness from getting up too quickly settle. You should notice that getting into a seated position feels smoother and more controlled, with much less strain through the lower back than just sitting straight up. Now that you've safely moved from lying down into sitting, there's one final step before you stand. The third and final step is the seated pelvic tilt. By this point, you've already done two important things. You've gently mobilized your sciatic nerve and you've used the log roll technique to get into a seated position without putting unnecessary stress on your lower back. Now it's time to prepare your spine for the biggest load in the morning, standing up. After lying in bed all night, the muscles and joints that support your lower back haven't been moving for several hours. And if you stand up immediately, your spine has to absorb your full body weight all at once. A few gentle pelvic tilts helps to gradually reintroduce movement, wake up the muscles that stabilize your spine, and make that transition from sitting to standing much smoother. Here's how to do it. Sit comfortably on the edge of your bed with both feet flat on the floor, about shoulder width apart. Slowly rock your pelvis backwards, allowing your lower back to gently round, then slowly rocking your pelvis forward, following your lower back to form a small and comfortable arch. Think of your pelvis as a bowl of water, gently tipping backwards and then forward. That movement should feel smooth and controlled, not forced. Repeat this motion about 10 times while breathing normally. You don't need a large range of motion. In fact, small and comfortable movements are usually all that's needed. As you perform the exercise, you may notice your lower back feels less stiff, and that sitting upright becomes easier. Some people even find that their first few steps feels less painful because they've actually prepared their spine instead of suddenly loading it. What you should not feel is a sharp increase in your leg pain or pain that continues to worsen with each repetition. If that happens, reduce the size of the movement or stop the exercise completely. After your 10 repetitions, you're ready to stand. Lean your body slightly forward over your feet. Push through your legs and use your hands on your thighs or the bed for a little assistance. As you stand, try to keep your back in a comfortable, neutral position instead of bending or twisting. Today, you learned why sciatica from an L4-5 L5-S1 disc bulge often feels worse first thing in the morning, and more importantly, you learned 3-step morning routine to help reduce leg pain before you even stand up. By gently mobilizing the sciatic nerve, using the log roll technique to protect your lower back and preparing your spine with seated pelvic tilts, you can start your day with less pain and reduce the chances of triggering a morning flare-up. If you followed along with this routine, which step helped you the most? Was it the supine sciatic nerve glide or the log roll technique? Drop a comment below, let me know. If you found value in this video, please give it a like and share it with someone dealing with sciatica from a disc bulge. Doing that helps more people find practical, non-surgical solutions that may help them move better and feel better. Remember to subscribe if you want more tips on how to protect your spine, better understand your condition, and learn the treatments that help people find long-term relief. Now, if getting comfortable at night is just as challenging as getting out of bed in the morning, go watch this video next on the best sleeping positions for an L4-5 disc bulge. I'll show you how to position your body to reduce unnecessary stress on your lower back while you sleep, and explain how we help patients wake up with less pain and stiffness.